Welcome to the DHI's guide to our care home COVID-19 clinical assessment tool. Throughout this video, we will go through the purpose of the trial, what you as a trial participant will be required to do, and work through an example of the assessment tool. The purpose of the trial is to test a clinical assessment tool that supports care home staff to assess, triage, and where appropriate, access specialist clinical input in the treatment of their residents. The tool should only be used when a resident is suspected of having COVID-19. And it should be noted that this application is not approved for use in service and should not be used as a replacement for standard care practices in the case of a healthcare emergency. Before beginning to use the application, we are asking that all participants complete a short survey that can be found using the link in the Before We Begin section of our user guide. It is important that all staff taking part in the trial fill in this survey before they begin to use the tool. The trial itself is scheduled between Monday the 4th and Saturday the 23rd of May. During this time period, the assessment tool will be live and accessible using the link in the user guide. This has also been shared with all care homes taking part in the trial. Upon opening the link, you will land on this homepage. Here you can click on About to learn a bit more about the tool, or on New in the top right corner to begin the assessment. This allows you to choose which category you belong to, these being either nursing or non-nursing staff. If you are unsure of which category you belong to, please contact the DHI using the details listed in the support section of the user guide. Once you have selected your assessment category, you will land on the situation section of this modified SBCAR. In this section, please enter in the resident's details as well as your own information. It is important that all staff fill in their contact details so that we can follow up with them to evaluate the assessment tool. Though we understand this will not always be possible, please fill in as many fields as you can. The situation notes gives you a space to include any brief general notes about the overall situation. Once you have completed the situation section of the SBCAR, we can move on to the background section. Here we are looking for all relevant medical details to be recorded. If any information is missing from the pre-selected fields that you feel is necessary to be included, please note this in the notes section at the bottom of the page. Once complete, we can move on to the COVID-19 specific component of the SBCAR. Here we detail when symptoms began to appear and what symptoms are. For the purpose of this exercise, this information has already been filled in as follows. Once we are finished, we can move on to the assessment section. The assessment section involves communicating your objective clinical assessment of the resident, including breathing, circulation, disability in regards to consciousness, and exposure. The details recorded here will be used to calculate the resident's News 2 score for nursing staff or the resident's risk level based on the nursing and residential home triage tool for non-nursing staff. This will be highlighted in the next section. Once we are finished here, we can move on to the response component of the tool. This provides you the opportunity to detail your own response and to make requests of higher level clinical support. There are standard questions you can select, and you can use the text box provided to ask any further questions. Again, during this trial period, please revert to standard procedure in the case of emergency. This tool is not approved for use in service, and we are unable to provide higher level clinical support during the trial. Once you've completed your assessment, please click on Actions in the top right corner to generate a PDF report of your assessment. Here you will notice that residents' private information has been redacted to protect their privacy. Additionally, this report will only contain the information you have included in the assessment. Once this report has been generated, please download and save the file to your device before emailing it as an attachment to the address in the user guide, support@dhi-scotland.com. Once you have sent this email, please remove the file from your device. Once received, this report will be reviewed by 4 GPs previously selected by the DHI. Their feedback will be combined with your own to develop a summary of the trial. This will then be shared amongst all care homes that have participated in the trial. For support or to ask any questions, please contact Kieran Morrison using the details in the support section of the user guide. Thank you for watching.